diet culture, entertainment media, trauma, weight teasing, and body shaming. While there is no one cause, these environmental factors are linked to someone developing an eating disorder. At least 30 million Americans suffer from an eating disorder sometime during their lifetime. The disorder we're going to spotlight today is called bulimia nervosa. People suffering from bulimia go through a cycle of behavior called binging and purging. Binging consists of consuming large amounts of food. Purging is the action of expelling the large amount of food eaten in an unhealthy way. Different methods may be used to purge, like self-induced vomiting and the misuse of laxatives. This repeated behavior causes damage to the heart and organs and denies the body of fluids and nutrients it needs. It's a serious and possibly life-threatening eating disorder. What are the warning signs and symptoms of bulimia? Behavior revolving around weight loss, dieting, and control of food are the main concerns for those suffering from bulimia. They are self-critical of body weight and shape. They may appear uncomfortable eating around other people and withdraw from social eating. Evidence of binge eating include the disappearance of large amounts of food, lots of empty packaging that indicate consumption, spending large amounts of money at drive-thrus and grab-and-go places. Evidence of purging include frequent trips to the bathroom after meals, excessive use of mouthwash, mints, and gum, damage to teeth and gums due to stomach acid, cuts and calluses across the top of finger joints from induced vomiting, stomach cramps, constipation, and acid reflux problems. How can bulimia affect daily life? Mental health issues, extreme mood swings, low self-esteem, creates problems with relationships and social functioning, anxiety and depression, misuse of alcohol or drugs, self-injury, suicidal thoughts, or suicide. Physical health problems include dehydration, heart problems, tooth decay and gum disease, digestive problems, acid reflux, dry skin, fine thinning hair, brittle nails, absent or irregular periods in females.
Bulimia nervosa can affect major areas of daily living. The main area is swallowing and eating. Bulimia can make someone very uncomfortable eating around others or in a public setting. It can almost become a phobia for them. If a person is affected by bulimia and they are using self-induced vomiting as a way of purging, it can affect the stomach lining. The stomach acid that's coming up can have a negative effect on the throat. It can cause soreness, burning, and can cause dysphagia, which is a condition that makes swallowing food very difficult. Another area that can be affected is health management and maintenance. Bulimia not only affects a person's ability to swallow, but it can cause major weight loss, damage to internal organs, and can increase the risk of cardiovascular issues like heart atrophy, a condition that causes the mass of the heart to decrease. And this can happen when the heart isn't getting enough nutrients or oxygen. Bulimia not only affects a person's body physically, but it can also have mental and emotional tolls. It can affect relationships with family members and peers, and as well, according to the British Columbia Centers for Excellence in Eating Disorders, bulimia can also take a major toll on a person's sleep habits. Okay, so now that we've talked about bulimia, the definition, signs, symptoms, how it affects our activities of daily living, We're going to talk about 4 intervention plans. The first one is a healthy exercise routine that we can establish. We can work on clients' physical goals and what they want to achieve. Bulimia, a lot of the time, it's more of a body dysmorphia and a body image issue. So we really want to work on that and make the client feel healthy and strong and give them a positive look on their self-image. The second one is to establish a healthy diet plan, work on meal prep. A diet plan can be in the form of a chart or a food journal. This way the client can track meals, how they are feeling after a meal, how they're feeling leading up to a meal, if they want to do like portion sizes, what exactly they want to eat, help them to feel more in control of their diet. The third one is to modify a routine to create and establish a healthy sleep schedule. We could introduce calming and sensory techniques. We all know how crummy it feels not to get a good night's sleep and how it can affect our mental health. The fourth one is to create an emergency prevention plan, prevent relapse. Bulimia can often have a symptom or a side effect of depression that can come along with suicidal thoughts. So we want to make sure that our client is safe. We could do a contract. We could sign it, have the client sign it, and have a loved one sign it. We really just want to make sure that everyone is staying safe. Recovering from an eating disorder is not the same for every individual. If you suspect that you or someone you know has bulimia or another eating disorder, it is important to seek help immediately. Because it's related to self-image and not just food, bulimia can be hard to overcome. Seeking treatment can improve self-esteem and to help create a happier and healthy lifestyle. Thanks for watching.